So moving to the another question, the cabo surface angle for inlay cavity preparation is, well, first of all you should know what is cabo surface angle. So it is the angle that is formed by the junction of the prepared tooth wall. Suppose you have prepared this tooth wall, and so it is the angle that is formed by junction of the prepared tooth wall and the external surface of the tooth. So which one is this one is the external surface of the tooth. So this angle refers to the cabo surface angle. So cabo surface angle, it is defined as the angle that is formed by junction of the prepared tooth wall and the external surface of the tooth. So this angle is important in dental restoration as it will impact the fit, stability and longevity of the restoration. So why do the cabo surface angle matter? Its significance lies in the role in ensuring the longevity and stability of the dental restoration. So dentist aims to create an ideal cabo surface angle. The prepared cavity wall should meet the external tooth surface at angle that provides the mechanical retention and resistance form for the restorative material. So a well-designed cabo surface angle would help to retain the filling material within the cavity. It will prevent the filling from getting dislodging due to the biting, chewing forces. An improper cabo surface angle can create stress points that may lead to restorative failure. Now what is this cabo? The question is, the cabo surface angle for the inlay cavity preparation is? Well, the cabo surface angle will depend upon the type of the restorative material that is being used. When preparing a tooth for a composite filling or amalgam filling, the cabo surface angle typically ranges from 90 degrees. That is for the amalgam. Whereas for the gold inlays, onlays, the cabo surface angle is around 150 degrees. To ensure that the inlay remains securely in the place, the cavity must be prepared in a way that provides both retention and the resistance form. So cabo surface angle of 150 degree helps in achieving this balance. So that is why your answer is 150 degree. The cabo surface angle for the inlay cavity preparation is how much? It's 150 degree. Next question, the factors that most affect the adaptation of gold wall to the cavity walls, that affect the adaptation of gold foil to the cavity walls. It's the direction of force that is applied. So in order to ensure maximum adaptation of gold, the force of condensation should be directed at 45 degree. So this angle is 45 degree. So this is the condenser, and this is angle at which the force of condensation should be directed. So suppose after that the force of condensation is 90 degree. So suppose this one increment has been, the first increment has been done at the 45 degree. After that the force of condensation is at 90 degree. At 90 degree to the previous condensed gold. So that will this 90 degree would prevent the displacement of gold piece that has been already condensed. So that is why the direction of force, it is important. So while condensing a piece of direct gold, you have to start at the one end and proceed to the other. So you have to just start from the center and reach toward the periphery. So start at the one side of cavity and proceed in straight line to the opposite side. then return to the original site on a different straight line. So during a condensation process, the condenser should overlap at least half of the previous condensed area. That is known as a stepping. So that is again important for your exam point of view. So stepping involves the overlapping the previous area of a condenser stroke by half or 1/4. So suppose the next is to cover at least 1/4 of, or at least 1/2 of the area. So this uniform pressure and compaction that is essential for the hardening and welding of the restoration. So due to this, a cohesive mass is achieved. So this also helps to eliminate voids. The stepping process, it helps to eliminate the voids. So apart from that, it will improve the adaptation of the restorative material to the cavity walls. So condenser, they are the instrument that is used in delivering the forces of compaction to the direct gold. So this one is the condenser. So there are two types of condenser. You have to remember that the two types of condenser, one is the hand condenser and other is electro condenser. So the hand condenser, they are used with a hand mallet. They have a long shank, whereas the condenser for the electro mallets, these condenser have a short shank that fits into the malleting handpiece, and they are used with the electro mallet. The nib, it comes in various shape and size. There can be a round nib, parallelogram nib, or rectangular nib. So all these condenser nibs, they have pyramidal serration to prevent slipping on the gold, ensuring a efficient condensation. So that is why the direction of force is very important. It is the most important factor that affects the adaptation of gold foil to the cavity walls. So that is your answer. Moving to the next question, the cohesion of gold foil, it is an example of, well, cohesion, it refers to the attraction of atoms of molecules of the same substance, right? In the case of gold foil, this cohesion, it is achieved through atomic attractions, that is a form of bonding. So the gold foil, it is composed of gold atoms which are closely packed. So these gold atoms will have strong atomic attractions with each other. That is why they remain cohesive. So now when the gold foil, it is condensed or packed in a cavity preparation, the atoms at the interface of the foil layer come into very close proximity. So due to their natural atomic attraction, these gold foils tends to bond or weld together at molecular level. So this welding action occurs as a result of mechanical pressure that is applied during the condensation process that we have already discussed. So as more and more gold foil it is condensed and welded together, it forms a solid mass of restoration. So that create a durable restorations. So cohesion in the gold foil restoration, it is result of strong atomic attractions between gold atom that leads to welding together. Next question. Another name of electric precipitate of gold is the matte gold. Matte gold is another name of gold that is produced by a process that is known as electrolytic precipitation. So what is matte gold? Matte gold, it is a crystalline gold that is formed in strips. So matte gold, they are cohesive, they can be cut by dentist into desired shape. So matte gold, they are recommended, remember they are recommended for internal building up of restoration. What is gold dent? Gold dent, it is a combination of powdered gold and gold foil. So gold dent, it is a combination of powdered gold and gold foil. The ratio is 95 is the powdered, 95% is the powdered gold and 5% is the gold foil. The powdered gold, it is also known as EZ gold. So powdered gold, it is a blend of gold particles that has been broken down into fine particles. That means they have been atomized. So the other name of electrolytic precipitate of gold, it is the matte gold. For the class 5 direct filling gold preparation, the retention points they are in. Well, in the class 5 cavity, it has generally a trapezoidal outline that typically involves the occlusal and gingival line angles. So the main retentive features are the gingivo-axial line angles. So that helps to ensure there is proper retention of the gold restoration in the tooth. So answer is occlusal and the gingival line angles in the tooth. So retentive points are made at the gingivo-axial line angles. The packable composite, they are based on which principle? Well, the concept of condensable or packable composite, it is based upon polymer rigid inorganic material matrix material, that is PRIMM, that stands for polymer rigid inorganic matrix material. So imagine a scenario where a patient requires a class 2 dental restoration that involves the repairing a cavity on the occlusal surface. So traditionally the dental composite, they consist of resin matrix mixed with the filler particles, where the resin will encapsulate the filler particles. However, in the packable composite, they are made up of two components. One is the organic resin matrix and other is the inorganic ceramic filler component. Now the filler component, it will mainly consist of materials like aluminum oxide and glass particles such as barium aluminum silicate. So here the resin, it is incorporated into fibrous ceramic filler network. So that means that the resin, it is distributed within the fibrous structure of the ceramic filler. So the irregular shape glass particles, they will create spaces within the filler particles. When the resin it will interact with the irregular glass particles that lead to bonding. So this type of material will be advantageous as they have increased flexural strength, low wear, high curing depth, and decreased shrinkage. So the packable composite, they are based upon polymer rigid inorganic matrix material concept. Which of following should be used to clean the operating site before giving a composite restoration? Before the insertion of composite restoration, it is common practice to clean the operating site with pumice slurry. So this pumice slurry, it is used to remove the plaque, pellicle and superficial stains from the tooth surface, ensuring the tooth it is clean and prepared for the bonding process. So profile paste containing glycerine and fluoride, they should be avoided as they may interact with the acid etching technique and compromise the bonding. Moving to the next question, type 1 etching pattern involves. So in type 1 etching pattern, the central part of enamel rods, it is dissolved, whereas the peripheral part is intact. So it involves the central part of the enamel rod, whereas the peripheral part is intact. Whereas in type 2, the peripheral part is removed, and type 3, it is a mixed pattern. So your answer is type 1. Regarding the heat produced during the cavity preparation, which of following is false? The answer is C. The correct statement is that the steel burrs they produce, it is the steel burrs that produce more heat as compared to the carbide burrs. The steel burrs, they are less efficient at cutting and tends to generate more heat during the cutting process. Whereas the carbide burrs, they are known for their efficiency and ability to cut efficiently with less heat generation. Longer the time of cutting, greater is the local temperature raise. So when the dental instrument, they are used to prepare a cavity in the tooth, friction between the instrument and tooth, that will generate heat. So longer the cutting procedure, more heat is produced in the localized area. Use of coolant decreases the amount of heat production. Coolant in the form of water or a specialized dental spray, it is used during dental procedure to reduce the heat generated by the cutting instrument. So that helps to dissipate the heat and keep the tooth and surrounding tissue cooler. Without coolant, diamond instruments generate more damaging heat. So diamond instruments, they are known for their efficiency in cutting, but they can generate more damaging heat if used without coolant. So proper cooling, it is essential when using the diamond instruments to prevent the excessive heat buildup. During the class 2 cavity, axial wall depth in crown and root should be in class 2 cavity preparation, the axial wall depth in the crown and root, they are important consideration. So the crown axial depth, it is, remember the crown axial depth, it is 0.5 to 0.6 mm. It's within the enamel of the occlusal surface. So the main objective is to remove the carious lesion or damaged enamel and provide space for the restorative material. So a shallow depth in occlusion portion, it helps to preserve as much as healthy tooth structure as possible. Whereas in the case of root, the axial depth should be 0.75 to 0.8. So in the root it is slightly deeper than the crown. So this depth, it is necessary to ensure that the restoration extends below the gingival margin and provide sufficient retention and the resistance form. So the deeper root axial wall, it helps to ensure that the restorative material, it bonds well within the tooth structure, reducing the risk of marginal leakage. The next question, after the restoration, the order of removal of matrix and wedge. So after restoration, the order of removal of matrix band, the order is, the answer is, first you have to remove the retainer, then matrix band, and then the wedge. So first of all, you have to loose and remove the retainer. The retainer, it is the part of the matrix system that holds the matrix band in place around the tooth being restored. So you have to detach the retainer from the band. So this is done while the wedges, they are in place. So while removing the retainer, it is essential to stabilize the matrix band. So place a fingertip on the occlusal surface of the restored tooth to prevent sudden movement or torquing. So remove the matrix band. With the retainer removed, the matrix stabilized, gently slide each end of matrix band in oblique direction and move it in an occlusal direction. So this technique would minimize the risk of fracturing the marginal ridge while dislodging the band. After the matrix band they are removed, you can proceed to remove the wedges. So wedges, they are just used to create space between the teeth to ensure a proper contact point. So once the wedges, they are out, check for any excess material in the interproximal area, such as amalgam or composite. So you can use amalgam knife or an explorer to remove any excess material. The next question, all are the indication for the complex restoration except. So what are the contraindications? If the patient, it has significant occlusal problems, that is the contraindication. So that is not an indication, instead it is a contraindication. If the tooth cannot be restored properly with the direct restoration, that is a contraindication. So answer is C. The pattern of caries progressing appears to have a lesion with the base toward the enamel and apex toward the dentino-enamel junction. It is caries on the smooth surface. So that will form like a triangle. The base is toward the enamel surface and the apex, it is toward the dentino-enamel junction. The caries detecting dye, it can stain the following except. So the caries detecting dye, they do not typically stain the reversibly denatured collagen. So the reversible denatured collagen, that indicates a stage of demineralization where the collagen structure, it has not become irreversible damage. So the caries detecting dye, they are more effective when the irreversible damage has occurred. So answer is C. The posterior composite, they are contraindicated in the composite resin restoration. They require a good oral hygiene maintenance to prevent the reoccurrence decay and ensure the longevity of restoration. So the poor oral hygiene will lead to increased risk of caries, and that would cause failure of restoration. So answer is C. So the posterior composite, they are contraindicated in these conditions.